Anxiety is something an estimated 44 million adult Americans deal with, according to the Anxiety and Depression Association of America. It is normal to feel occasional anxiety throughout your life. However, if it is an excessive irrational dread of everyday situations, when anxiety interferes with your daily activities, you may have an anxiety disorder. There are multiple types of anxiety disorders. A few are generalized anxiety disorder, panic disorder and panic attacks, and social anxiety disorder. Generalized anxiety disorder is characterized by persistent and excessive worry about a number of different things. You worry more than what is warranted and expect the worst even if there is no apparent reason for worry. Generalized anxiety disorder affects 6.8 million adult Americans. That is 3.1% of the American population. Panic disorder is diagnosed in people who experience out-of-the-blue panic attacks and are preoccupied with the fear of having another one. Panic disorder usually doesn't begin until adulthood, although some children have been known to experience panic-like symptoms. About 2 to 3% of Americans experience panic disorder, and it is twice as common in women than it is in men. Social anxiety disorder is intense anxiety or fear of being judged or rejected in social situations. Social anxiety disorder affects approximately 15 million Americans and is the second most commonly diagnosed anxiety disorder. Anxiety disorders can wreak havoc on those who suffer from them, including myself. My anxiety is what made me fear so much of this class. Anxiety is not something that you can just get over. Anxiety, for those who have it, is the biggest obstacle in their lives. Although anxiety cannot be cured, it can be treated. Despite the effective treatments available, though, fewer than 5% of those who suffer from anxiety disorders seek treatment within a year of their onset. More than a third of people report having symptoms for more than 10 years before they seek treatment. If someone you know suffers from anxiety, let them know they are not alone, help them seek treatment, stay by their side, and reassure them that you will not look at them differently and that everything will be all right. I promise you they will be grateful and remember it for the rest of their lives. There are different treatments available for those who suffer from anxiety disorders. There are different types of therapy available as well as medications that you can be prescribed. There are many types of therapy that help reduce your anxiety. The first is cognitive behavioral therapy. Cognitive behavioral therapy is short-term and goal-oriented. It offers hands-on practical approach to problem solving. Many people start to see results within 12 to 16 weeks. Cognitive behavioral therapy helps you learn to control your thinking and maintain a sense of control and self-confidence. Another type of therapy used is exposure therapy. Exposure therapy is a process for reducing fear and anxiety responses. In therapy, a person is gradually exposed to a fear situation or object, learning to become less sensitive over time. Acceptance and commitment therapy, also known as ACT, is a type of therapy that uses strategies of acceptance and mindfulness along with behavioral changes and commitment as a way to cope with unwanted thoughts, feelings, and sensations. Other than therapy, there is also medications for those who suffer from anxiety disorders. Selective serotonin reuptake inhibitors relieve symptoms by blocking the absorption of serotonin by several nerve cells in the brain. This leaves more serotonin available, which improves your mood. Benzodiazepines are frequently used for short-term management of anxiety. They are highly effective in promoting relaxation, reducing muscular tension, and other physical forms of anxiety. With all of the different treatments available for anxiety, the 44 million American adults affected can find a better way to relieve their symptoms so they can try to live a worry-free or at least less worrisome lifestyle.